the very things that you've been told about natural birth are what leads to you ending up having a birth that's more painful, traumatic, and can even lead to more unnecessary interventions? Today on the Empowered Birth series, we're going into the 20 natural birth traps. If you've been following me for a while, then you probably already know about the natural birth traps. These are the things that undermine your confidence when it comes to planning and getting your true natural birth. It's what's perpetuated in our birth culture, and it's what's reinforced within our medical birth culture, which basically comes down to this. Your body is broken and defective, it needs to be efficient, and we're going to do things to you to make it more efficient so that you can birth safely. In other words, it strips you of your agency, and there's a reason for this. And if you've been following my content for a while, you also probably know about my concept of true natural birth. So the difference between true natural birth and natural birth as perpetuated within our birth culture and medical system is that true natural birth is what your body is already going to do anyway. It's like organic ice cream that you get at a dairy farm. You've been able to pet the cows, you know that they're grass-fed, and you know that there's no preservatives. As opposed to natural birth within our birth culture and medical system, which, as I'm going to be teaching you, leads to the natural birth traps, which is basically the preservative-laden frozen dessert version of ice cream. And if you open it, it looks like ice cream. But if you look at the ingredients list, it's preservatives, and it's called frozen dessert, not ice cream. This is basically the difference between true natural birth and natural birth in the medical system. And true natural birth is also called physiological birth. But unfortunately, because of generations of medical gaslighting and control and perpetuating of birth trauma as normal, we have forgotten about true natural birth. It has been so ingrained in our culture to follow the natural birth route that we don't see these things as natural birth traps. And we wonder why our bodies aren't working properly. We wonder why our birth ended up in trauma. We wonder why we had more pain in our birth. This is why, the natural birth traps. And I talk about this inside of my book, Your Empowered Birth, which you can get on Amazon. You can also go into the Empowered Birth book playlist on my YouTube channel. If you're watching this video outside of YouTube, I also want to just let you know about the YouTube channel, because basically this is the do-it-yourself path. I have 3 paths to getting empowered birth. One is completely do-it-yourself and free, and you don't even have to put in your name and email or subscribe to anything. The second path is self-study. I have 2 tiers within the self-study path. One is complete self-study, where you can take any one of my courses, you can sign up for my newsletter, and you can get that birth education. I put all of my courses out for free because I believe that information needs to be accessible, and if you can do it yourself, why not? The second path of self-study, though, is the VIP version. And self-study VIP is basically you pay for the course, but you're not paying for the information. You're paying for access to me. And then what this allows me to do is I can take some time to do some laser coaching with you if you get stuck. You do get a complimentary laser coaching session with each course that you purchase. And you also are getting access to email support, direct email support. The thing about the self-study VIP is that you can jump in anytime you want. And if you want to have a test drive on this, all you have to do is go to empoweringmomsbirth.com/workshop and get your Empowered Birth Workshop, which I take you through the basics of how to get past your fear, understand what's really going on in the medical system and our birth culture, and also giving you a crash course on true natural birth and how to have a more painless experience, as well as a whole bunch of tools on birth advocacy. You can learn more, as I said, if you go to empoweringmomsbirth.com/workshop. This will allow you to check out the free version of the program. And as I said, it's completely free. You can choose at any time to upgrade to self-study VIP. But this is basically because path number 3 is premium coaching. And I don't work with just anyone. I only take a handful of students. If I'm doing a group program, it's usually about 3 to 5 people in the group program. I keep things very intimate. There's a reason for that. I noticed that this was how I was able to get that incubator of support for my clients, where they would be able to get these amazing results with their birth experiences and have that confidence. I also put a lot of my expertise and a lot of my energy into these coaching sessions. So that is, again, why I have the complete self-study, because I honestly can't take on everybody who comes to me. And I wanted to make sure that this information was out there because I believe in empowered birth. I truly believe that you are your own best expert. I truly believe that you are your own best decision maker. And I don't want you falling into these natural birth traps. So again, when you go through this list, and you can go and get it off of my website, empoweringmomsbirth.com/freebies, if you want a copy of it. There is also a link in the description of this video, so you can go and get it directly. But what you need to understand about the natural birth traps is this is what's causing you to have your confidence undermined. You think, I'm really confident and I can give birth naturally, but then you fall into one of these traps and suddenly you're doubting yourself. Or one of these traps actually sabotages your natural birth. And because of the way our birth culture is set up, and because of the way that the medical system has been taught to view birth, and they can't see the water they swim in, these things have been seen as normal. So you don't know that they're a trap until later in hindsight, when you understand deeply the physiological process and what is lost when you interfere with that. So if you do want to understand more about the physiological process, you can go and get Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage. But I also go deep into this inside your Empowered Birth workshop, which again, if you check out that workshop, I go into an entire crash course on true natural birth to help you. And because of the way that the course is designed, it is specifically designed to help you get through all of that fear and any underlying perpetuated ideas about true natural birth versus natural birth, so that you are more confident when it comes time to advocate for yourself and create your birth plan. I noticed that this was the missing piece when it came to planning a natural birth, and this is how I actually got tricked the first time. And if you want to know more about my story, you can again go and read Your Empowered Birth. It is available on Amazon, or just check out the Empowered Birth book playlist, because information is free and I only charge for access to me. So now that you understand that natural birth traps are a thing and that they are going to cause you to have your birth derailed, the next step is understanding what these traps actually are. And I have a list of 20, as I said. Go into the description of this video and get the full list if you want it. I'm also going to be going deeper into all of these 20 traps, so you will have videos on that as well. These deep dive masterclasses are basically my way of giving back and making sure that you get the information that you need, because I do charge quite a premium for my services as a coach. I'm worth every single penny. And at the same time, I don't want you to be left behind. The other thing that I've noticed is that a lot of education that you really could use is either hid behind a paywall or hard to access, or you have to have a lot of knowledge about medical terms to understand it. And I want to cut out all of the guesswork for you. I want to make this easy for you. A lot of doulas and midwives, while they have amazing information, it can be very dense and hard to really digest. So my goal with Empowered Birth is to make this information digestible for you, and also bring in the context and backstory that is often missing in this information. Because information on its own is good. However, if you don't have the context and you don't know where all of the different perspectives are coming from, that can lead you back into fear. And again, if you want to know more, go to empoweringmomsbirth.com/workshop. Go sign up for the email newsletter, and you're going to get this course as well in your training. You're going to be able to go through the whole thing, and there's workbooks, there's PDF guides. You can learn more about that on the website. So now let's get into those 20 traps that I mentioned. And number one on the list is growth scans at the end of your pregnancy. While it can be helpful at the beginning of your pregnancy to do a growth scan just to know where you're at, if you're looking to know your due date, which again, this isn't an exact science, but it can be helpful. What happens is that at the end of your pregnancy, your baby is on their own growth curve. And this is actually where I got tricked. This is where a lot of moms get tricked and they fall into the induction trap because they're told that their baby is either too big or too small, which then undermines their confidence and gets them scared, thinking, oh, I have to induce because my baby isn't growing properly, which was my case. But I was able to use a lot of tools that I'd learned in other areas of my life. I used some critical thinking skills to be able to be like, well, wait a minute. What if he's just on his own growth curve? And I was able to avoid that induction versus the mom who's told that her baby is going to be big. So she induces and then she finds out that her baby is actually a lot smaller, but she ended up going through the trauma of induction and a C-section just to find out that her baby is only 7 pounds. So in my case, I was told my baby was too small. He was in the second growth percentile for his age. And then at 41 weeks, this kid comes out and he's almost 8 pounds. So understanding that growth scans at the end of your pregnancy are a huge natural birth trap. If your care provider is pushing these as a matter of routine, chances are they're also going to then try to suggest an induction if your baby is too big or too small. So if you are looking to have a true natural birth, you don't actually want to do this. If you are making a decision about having a growth scan, you need to do it from a place of power, not a place of fear. And I do have a decision-making workbook. You can either email my team, hello@empoweringmomsbirth.com, or better yet, you can just get the entire workshop and then you have everything that you need to make an empowered decision. So then the next thing on the natural birth traps list is due dates, number 2. Due dates are a huge natural birth trap because of the different range of dates that your baby could be born at. And as I said, your baby is on their own growth curve. So you could be giving birth at 37 weeks or even 42 weeks, and that is still normal. Unfortunately, the medical system has pathologized going past 40 weeks, and with so many doctors inducing moms at 39 weeks, telling them that it's going to reduce their chances of having a cesarean, we have a huge, huge epidemic when it comes to induction. And so many moms now think that going past 41 weeks is basically a danger zone, and they start to get afraid. And if this is you, then I'm going to encourage you to check out some of my other master classes, specifically the one where I talk about due dates. I go deep into it and I tell you about why the due date is basically a guess date. I give you some evidence from Dr. Sarah Wickham's book, In Your Own Time. And of course, you can also get more information if you go and get your Empowered Birth Workshop, because there's a whole module that I've done on avoiding the induction trap. But what you need to understand about due dates, again, is that they're completely arbitrary. You don't need to induce just because you go past your due date. You don't need to get things going just because you're at your due date. And you don't need to freak out if you pass your due date. Because once you start doing that and you start to have your confidence undermined, this is when the medical system steps in and pushes interventions, or you're pushing on the outside by trying to do all the things, which can also delay the onset of labor. And if you need to understand more about that, again, Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, has a whole chapter on what happens in a physiological birth as you get closer to the day that your baby is actually going to be born. This also ties into number 3 on the list, which is vaginal exams, or what we call cervix checks. Your cervix is not a crystal ball, and your cervix can actually dilate and close back up again multiple times before you even go into labor and during labor, depending on what your body needs. And if you need more rest time, your cervix is going to close up. If you're feeling tense and afraid, your cervix is going to close up. And not only that, but the measurements are, again, arbitrary because care providers have different widths of their fingers, and they are also basically guessing from their fingers. So if you are choosing to have vaginal exams, Cynthia Gabriel talks about this inside her book, Natural Hospital Birth, where you want the same person examining you every single time to establish a baseline. But at the same time, you need to understand that your cervix doesn't want to be checked. If your cervix was meant to be checked, then it would be on the outside of your body. But because of our medical-centric birth culture and the patriarchy that basically decided that women's bodies were defective and broken, we have this idea that the cervix check is necessary in birth. It's not. You can't actually determine whether you're going to go into labor or whether you are in labor or whether that labor is going to progress to the point where a baby is going to emerge by doing a cervix check. They are painful, they can be traumatic, they can slow your labor down, they can introduce infections, and there's just so many variables that come with doing these cervix checks that can derail your true natural birth. So my advice is that if you are going to choose a cervix check, you need to know why you're doing it. And you need to also recognize that if you open the door to that, you can open the door to even more interventions later based on those results. This almost happened to me during my home birth. I got really frustrated and I was curious. So I asked the midwife to check me. She said I was 4 centimeters. She asked again about 4 hours later. I said no, and I didn't want the cervix check. But then 4 more hours passed and nothing was happening. And she's like, let's check you again. And I was 6 centimeters. And at this point, it was horrifically painful. And my labor just shut down, like completely shut down for 16 hours. If I had been in the hospital, you know how that would have gone. But because I was at home, I told the midwife it was a false start. I sent her home. And I didn't call her back until I was actively pushing. So when my labor started back up again, I didn't have a single cervix check. The only time that I actually checked myself was when my waters released, and my partner was at the time, he was like, well, do we call the midwife? And I wanted to make sure that the baby was actually coming. So I just checked and the head was right there. There was no cervix. It was just all head. So I'm like, oh, I guess she's coming. So understanding this, that cervix checks don't actually mean anything. They're arbitrary. They can cause infection. They can cause all sorts of cascades of interventions. They set the stage for you to have more cervix checks that you're declining later. You just don't want them. They are such a huge natural birth trap, and they're just not worth it. Unless you're actually needing to get some data to make a decision, say no. And that also ties into number 4, which is membrane sweeps. If you agree to a cervix check, you are risking your care provider just sweeping the membranes just to get things going. Yes, they do this. They also sometimes break your waters if they think that that will speed up the process. This is a whole big consent violation. But unfortunately, because of the way that our birth culture and medical system is, many moms don't know the difference. So they'll say, I had a really painful cervix check. It shouldn't have been that painful. And then afterwards, there was blood on the care provider's fingers. And I'm sitting there and I'm like, they stripped your membranes. I know exactly what they did. They stripped your membranes and they didn't tell you, and they just did it. Now, if they do tell you that they're going to strip your membranes or offer to strip your membranes, this is again something you don't want to happen. Because the amniotic sac protects your baby, it gives you a cushion of fluid, and as your cervix is opening up, what would you rather have? A squishy water balloon that slowly and gently opens your cervix, or a big heavy bowling ball? The other thing about the amniotic sac that you need to understand is that that cushion of fluid allows your baby to move around. If your baby is not able to get in a good position, you are more likely to have back labor. So having a membrane sweep can also weaken your membranes over time, especially if you have more than one, which then can lead to your waters releasing before they were intentionally going to release if you had never done that membrane sweep. This means that if your body had said, okay, we're not going to release the waters until the baby is actually on the way out, and this is going to be a very gentle labor, if you have now messed with the process, your bag of waters are no longer going to be as strong, and they're going to release before that. Baby may not be in a good position. This can then lead to the back labor, and then this can also lead to malpositioning and more complications. If, however, you leave your membranes alone by not having these membrane sweeps, yes, you're going to basically still be pregnant. You're going to be pregnant anyway. There are so many moms that go and get these membrane sweeps once a week, and it still doesn't bring on labor because it's not meant to. However, what it does do is it risks you ending up having your waters break prematurely, which then causes all kinds of problems. It can also lead to infection. There are risks with membrane sweeps. So if you understand this and you understand birth physiology, you recognize that membrane sweeps might be a good idea if you're already planning to get an induction. But if you're not planning to get an induction, this is still an induction. And it's going to mess with your physiological process. So if you want a natural birth, stay away from membrane sweeps. So number 5 on the list is unsupportive comments and pressure to induce. Now, this isn't just from the medical system. This is also within the birth culture itself. Family and friends. Have you had that baby yet? Well, what if they break your waters? What if you go and get a membrane sweep? You can't stay pregnant forever. All of this is not helpful. Yes, you're incredibly uncomfortable at the end of your pregnancy. I hear you. I had prodromal labor for 4 weeks with my daughter. Stop and start labor that was driving me absolutely crazy. I am a birth advocate. I had already spent 2 years researching birth. I knew everything that there was about my body to be able to birth effectively, knowing that I did not want to induce. I knew that getting a membrane sweep wasn't going to help anything, and it was actually going to be worse. I knew that I didn't want cervix checks, and even me, I was still going crazy with this prodromal labor. Okay, so I totally get not wanting to be pregnant anymore. This is why it's important that if you've got people who are induction happy, or they have that cultural indoctrination of thinking that you have to go into labor by 40 weeks, and they start to put pressure on you, you need to tune these people out. And what I had to do is, at the end of my pregnancy, I had basically told everybody the wrong due date. I told them my baby was going to be due April 12th when I knew she was actually coming closer to March 29th. She ended up being born on March 31st. So by doing this, by making up an arbitrary date that was further out into the future, past 42 weeks, I was able to protect my mindset a little bit better. I also made sure that I wasn't unnecessarily stressing myself out about my due date. So I even tricked myself into thinking that she was going to come April 12th, even though I knew that theoretically she was probably going to come at 41 weeks. I still had that mindset of, oh, she's not due for another couple of weeks. This is how I was able to stay strong in my convictions. That's like, if she comes early, that's nice. But if she doesn't, it's not the end of the world. It's just really, really frustrating. Plus, I did try to do some of those methods. I did the sex, I did the spicy foods, I was doing the exercises, I was taking the evening primrose oil capsules, stuffing my vagina like a clown car, literally. I had 8 capsules inside, and I was taking 8 orally every single day. And I was doing the red raspberry leaf tea, and I was doing the spinning babies exercises, try to encourage her to get into a better position. And I am telling you from experience, nothing is going to make a baby come until they are ready to come. And the reason for that is because their lungs actually trigger you going into labor when they have the surfactant produced. And it's a protein that comes at the very end when their lungs are mature. If you want to know more about that and the different systems that are being perfected at the end of pregnancy, again, there is a module on this inside induction traps, inside of your Empowered Birth Workshop. You can again go to empoweringmomsbirth.com/workshop if you do want to take advantage of self-study and subscribe to the newsletter. Inside of the Empowered Birth newsletter, I give you more tips and information on natural birth and also how this ties into a more empowered motherhood, because how you come to your birth is how you come to your motherhood journey, and how your birth unfolds is what's going to teach you how to be the best mother you can be to this baby. So I am committed to you having an empowered birth, whether you work with me or not, whether you buy any of my programs or not, whether you enroll in self-study or you continue to go the do-it-yourself route, because I know that when you have an empowered birth, you're an empowered mom for life, and no one can take your power from you ever again. And part of this, again, is the right mindset of protecting yourself from that outside pressure. Speaking of pressure, number 6 on the list is castor oil. Remember how I told you that I tried all of the things? Well, one of the things I was not willing to do was castor oil. And the reason for that is because it irritates your bowels, but it doesn't just irritate yours, it also irritates your baby's. So while this can be helpful to get things moving in a labor that has already started and has been going for a while, and you want to get a kickstart going, which one of my clients did choose to do, if your labor has not started yet and you have not progressed to a certain point, you do not want to do this, because the baby could pass meconium, and then that can lead to the meconium aspiration that everybody is worried about. Plus, it's castor oil. It tastes disgusting. Even in midwives' brew, which they basically just put castor oil as the active ingredient, and then they have everything else to mask the taste. This is not a pleasant experience. You're going to have a really bad time. It is going to be painful. It is going to be messy. It is not going to be the peaceful labor that you are thinking of, and you're probably not going to have a water birth if you're choosing castor oil for obvious reasons. So this is why I call it a natural birth trap, because even though it's technically a natural induction method, you're going to have a bad time. It's not going to be fun. So if you want a more peaceful, painless labor, don't do castor oil. That's my advice right there. Speaking of painless labor, one thing that people don't understand is that there is a difference between trying to have a physiological birth at home versus trying to have a physiological birth in the hospital. And I actually experienced this firsthand, where at home I was laboring fine with my first baby. I was in the zone, and I probably could have had him a lot faster and a lot easier had I stayed home. But because I didn't yet know that I could call the midwife to me at the last possible minute, I didn't know all the loopholes yet. I didn't yet see how difficult it was to birth in the system. I went to the hospital. What happened when I got to the hospital is that those contractions that I was able to handle so easily at home were so much harder to concentrate through in the hospital. And the reason for this is because I was left basically alone while my partner went to the car to get our things. And this is the point when the nurses started trying to get me to do things. The nurse wanted to take my blood, and I have a fear of needles. So this caused a lot of anxiety, and I started to tense up intuitively because I didn't want that needle. This then led to a lot more pain during my contraction, which I then had to breathe through. In fact, the only time that my labor was actually painful was when I was being distracted from my own intuitive process and either having to fight with somebody and tell them no to a vaginal exam or no to a blood test, or when I was flat on my back and having to go through and have this non-stress test done to just get that 20-minute strip because I was in triage. The other thing I noticed is that contractions hurt a lot more when you are having a cervix check, which is again why I said that's a natural birth trap. So my typical suggestion, if you are planning to have a true natural birth, is go to the hospital at the last possible minute or just plan a home birth. Now, I know that planning a home birth can be really difficult if you live too far from a hospital. And that is why, as part of your Empowered Birth workshop and the bonuses that come with your Empowered Birth, I talk about different birth locations. And there is an alternative to home versus hospital, which basically you could go and stay at a hotel or rent out an Airbnb so that you're still close to the hospital if you need it, but otherwise you don't have to utilize it because the hospital is not set up for physiological birth. And my clients who attempt to have an unassisted birth in the hospital have been given a lot of tools. They typically have a doula with them. Their partner is really trained up to be able to support that, and they know that they can birth their baby themselves. So they are confident to do this whether somebody actually says it's allowed or not, but that takes a whole other level of training, and that is what I teach in my deeper level programs. I teach a little bit about it inside your Empowered Birth workshop, and I do teach it inside your Empowered Birth Academy because that is the core program that's basically telling you how to do it yourself and advocate for yourself so that you can have that hands-off birth that you really want. But if you're just looking for the basic education or you're not familiar with my method, then I suggest that you start with reading Your Empowered Birth or just watch the videos on the YouTube channel where I read that book to you, do those exercises, and then go into your Empowered Birth workshop, which again, go to empoweringmomsbirth.com/workshop. And if you want to know more about my Empowered Birth method, I do have a starter guide that goes into the full overview of the Empowered Birth method, why birth doesn't seem to work properly in the medical system, what to do about it, understanding true natural birth, the mistakes that first-time moms make, seasoned moms make, and VBAC moms make when trying to have a true natural birth. Basically everything you would need to know to have an empowered birth. I put it all out there for you because, again, information is free. You only pay for access to me, and I'm committed to you having an empowered birth, whether you work with me or not. So the thing about hospital birth that also kind of drives me a little crazy is that there are still a lot of hospitals that restrict food and drink. This does not happen at home. So number 8, restricting food and drink is a huge natural birth trap because you need to have sustenance in order to continue to birth. If you do not eat, what happens is your labor will naturally slow down. It may even stop like mine did. And then you're going to basically have that reprieve so you can get some food into you. Now, if you are in labor or going in and out of labor, then what I'm going to suggest is you want protein. You want easily to digest protein, and you want things that are, if they come up, it's not going to be an unpleasant experience because there is a point where your body is going to be heaving to get the baby out, and you might feel a little nauseous. Now, the reason why the medical system restricted food and drink originally, which you need to understand the context, is because way back when they started putting moms into the hospital, they were drugging them up on scopolamine and Demerol. This meant that these moms were basically unconscious. They were unable to move around. They wouldn't be able to turn on their side to throw up. So then this led to aspiration, which then led to a whole bunch of issues. And then later, they also started doing C-sections. And they're like, well, in case you need a C-section, we don't want anything in your stomach. But think about that logically for a second. If you needed a crash C-section, they're not going to care that you had food in your stomach. There's no other surgery that's an emergency where people are like, oh, wait a minute, did you eat anything? Oh, well, we can't do the surgery. They're going to do it anyway. So recognizing that this restriction on food and drink is actually quite harmful, because if you are dehydrated, that is a problem in your birth. Your body is not meant to be dehydrated. Your body is not meant to go without food. So your labor is going to slow down and shut down. And then at this point, this is when they introduce Pitocin to try to get things going. And they're like, I don't understand why this isn't working. Maybe you just don't birth effectively. No, you've been starved. So this is again why I suggest going to the hospital at the last minute, especially if there is a policy around food and drink. Because this way you can ensure that you have the food that you need and you have access to it on hand. The other thing is, even if you bring food to the hospital, you may not want the food that you packed. So trying to pack a whole bunch of food in your bag doesn't make a lot of sense. But if you go in at the last minute, you had a lot more time to basically eat and drink as you needed. And by the time you go in, you're not going to want to eat because you're actively pushing a baby out. And if you're having a home birth, then this is even easier because you've got the food on hand and it doesn't matter how long your labor takes, you've got that sustenance. So just remember that food and drink is important. And of course, I will be going deeper into this in later videos. Number 9 is something I already kind of touched on, which is exhausting yourself to get into labor. This is actually part of why I had so much prodromal labor, because I got so impatient by the end and I just wanted my daughter out that I started going against my own advice and my own learning, and I started doing all of the things. Now, this is what a lot of moms do, and I'm not going to make you wrong for it, but what happens when you are trying to get yourself into labor is you'll start to get practice contractions. And these contractions are actually the same signal that your body gives when you're having your period to tell you to slow down. We often ignore those signals and we pop an ibuprofen or a Midol to basically say, oh, well, I'm just going to push through. Because our birth culture and our society has basically been in this idea that we have to be doing things all the time and we need to be consistent. Women's bodies are not consistent. Our bodies are meant to be cyclical. We do not have a 24-hour cycle. We have a 28 to 32-day cycle. Depending on where we fall on that spectrum, we also have a lunar cycle that we are tied into. So understanding that our bodies do not work the way men's bodies work. But historically, men were the ones that came up with the idea of our bodies being pathologized and a problem that needed fixing. So if you want to have less painful periods, rest. If you want to have less prodromal labor, rest. If you want to have an easier labor, rest during early labor. Do not do all of the things, because this then has your body signaling to you, just like with your period, hey, we're going to be having a baby soon. It's time to get to your cave and rest. That's what your body is actually doing. That's why those contractions start to feel more painful, because you're doing all of the things and you think something's moving, but you're only 4 centimeters or you're not even 1 centimeter dilated. That's why. Because your body is actually trying to signal you to rest and to get ready and to prepare by resting to get into that meditative state that will allow the oxytocin to flow, but we've been taught to push on the outside. Do not do this. One of the things I tell all of my clients as we get close to the end is I say, look, you're going to turn off your phone. You're going to stop doing all of the things. You're going to stay closer to home. You're going to rest. You're going to get as much oxytocin flowing as possible, cuddle with your partner, watch a movie that makes you laugh and smile, and you're not going to think about getting into labor. You're going to do the complete opposite of what society tells you to do. And guess what? They go into labor. And often they're surprised by how easy it is when they go into labor. They're like, oh my gosh, I'm already in labor. Oh my gosh, like I didn't even think about it. And that is the state of mind you want. So do not exhaust yourself. The other thing is when labor starts, again, try to rest as much as possible, or else you're going to end up exhausting yourself to the point where labor stalls out, and then the medical system thinks this is a problem. If you're home, you can send the midwife away and say it was a false alarm. If you're in the hospital, it is much harder to leave. This is again why I suggest going in at the last minute, because if you go in too early and then you're like, well, I'm not far enough in labor, I'm going to try to leave. This is when the medical system can start to try to threaten you, scare you, talk you into staying, and otherwise make things a lot more difficult. Because of their own fear and their own training and their own concerns about liability, they will try to do everything they can to get you to stay if you are showing signs of labor. If you are not showing signs of labor, they tend to send you home, but then that in itself can be stressful and it becomes an ongoing process. So again, stop trying to do on the outside. And I will be going deeper into this in other master classes. You can also check out some of my other videos where I also talk about the things that interrupt your flow of natural birth. They are inside of the 26 things that you need to know if this is your first time planning a natural birth playlist, which again, you can check out on my YouTube channel. If you're already on YouTube, then just go into the playlist. If you're not, go to that YouTube channel. Go check out the playlists. And if you really want to know the deep dive secrets, though, I do suggest going and getting your Empowered Birth Workshop. Again, it's a complete self-study. It's free. The only thing is that if you want direct email support or any coaching support from me, that's when you pay. But otherwise, I'm perfectly happy to just give you that information because you deserve to have it. You deserve to have an empowered birth, whatever your budget is. And I would much rather you have that information, use it to your advantage, and hire a doula to support you and protect your birth space. Because if you have a doula, that is going to be a much better investment than trying to invest in just birth education. Now that leads into number 10. The reason why you want to have a doula is because unsupportive nurses who roll their eyes at birth plans can be a real pain in the ass. And the reason for that is because they don't trust birth. They don't trust the physiological process. I'm going to share a quick story about an unsupportive nurse and how my friend Jenny was able to combat that. So Jenny had already gone through your Empowered Birth Workshop 3 times. She knew the system like the back of her hand because she was also inside of my Deeper Dive coaching program. This was basically a deeper version of the Empowered Birth Workshop with more tools for advocacy. She had basically come to me after her traumatic birth and she said, I want to know what happened to me. I need to understand this. I want to teach it with you. I want to help you help other moms, but I'm probably never going to get pregnant again because I'm traumatized. And then as she learned the education, understood what had happened to her, and she was learning from me and we were teaching it to the rest of our students, this is when she realized that actually she didn't want the medical system to dictate whether she could have a second child. She'd always wanted to have 2 kids. She felt that she'd be doing herself a disservice if she let this birth trauma affect her for the rest of her life. She knew she would regret it. And so she decided to do the most revolutionary thing that the medical system didn't think was possible and choose to have an unassisted vaginal birth after cesarean. She had basically come into her appointments with her doctor saying, I don't want anybody to touch me. And her care provider was a little bit hesitant, but at the same time, he loved physiological birth and he saw it as an actual challenge and an opportunity to learn. And so he took Jenny on as a client and she basically showed everybody that this is actually a possible thing. But 1 hour before her daughter was born, when she was finally ready to go to the hospital and she had her doula, who was very strong-minded and knew how to basically keep the nurses from messing up the birth plan. She gets to the hospital. the nurse wants to check her immediately. She's like, I need to have a cervix check done to know when to call the doctor. And the doula's like, you need to call the doctor. The baby's coming. But the nurse would not budge. She would not call the doctor. She kept wanting to do a cervix check. And Jenny's like, no, that's not happening. Jenny's in her zone. And the doula was holding space, and Jenny's partner was holding space for Jenny. So the doula is on the outside as the gatekeeper to keep this nurse at bay. And the nurse also tries to do the Doppler to see where the baby's at, and she can't get a heartbeat. The reason she can't get a heartbeat is because the baby's already in the birth canal. So she's not going to get a good reading. She gives up on that. The other thing is she wanted to take Jenny's blood. She wanted to do a blood test, and Jenny's like, you're not touching me. Like, this is not happening. The reason why the nurse wanted to get that blood draw was because she needed to know Jenny's blood type in case Jenny had a C-section. So understanding that these unsupportive nurses are looking at these checklists, but because I taught Jenny about the empowered birth method, and I told her about the fact that the nurse is really just trying to go through her checklist, and if you have one of those nurses, this is what you do, she was able to prepare ahead of time for that. She was able to prepare her partner ahead of time for that. He was often listening in on our calls, and because Jenny was also my business partner and helping me with my website and helping me with the program, she got a deeper dive education than what I normally teach. But that allowed her to then also train up and hire the right doula, which was a friend of ours. And she's actually been on one of my interviews. You can go check her out. Her name's Michelle Short. If you go into the Empowered Birth interviews, you'll be able to see that she understands about painless childbirth and how it ties to sex. She's basically a resident sexpert, and she also has another interview on postpartum and sex. So you can go and check those out as well. But we knew that Michelle was going to be the best one to stand for Jenny because she knew that system and she was not going to let that nurse run things. So then Jenny has her baby, and the nurse is just absolutely like frustrated because she wanted to have things go a certain way, and Jenny didn't do that. And the nurse didn't call the doctor in time, so Jenny had an unassisted VBAC, but it was fine because Michelle and her partner caught the baby. So basically what happens is that Jenny gets her baby, and she is about to get onto the bed with her new baby. Placenta's still inside, but it's already transferring all of the blood volume. So within 10 minutes of the baby being born, the placenta is ready to fall out. And the doula, again, she's like, are you going to get that? And the nurse is like, what you're doing is dangerous. And Jenny's just looking at her like, how? How is this dangerous? The baby is already out. I'm fine. The baby is nursing. The placenta is on its way out onto the floor. Like, the birth is done. There is no danger here. Because the nurse had not seen a physiological birth, didn't know how to support it, she automatically saw that as danger. And that is where you need to understand that unsupportive nurses who've never seen physiological birth can be a huge natural birth trap because all they're seeing is pathology and danger through the physiological process, and they will want to control it. They will want you to follow their checklist, and it can be very difficult to advocate for yourself when you are in that state of labor because you need to be focusing on your physiological process, not outside fears. So this is why one of the components inside your Empowered Birth Workshop and deeper inside your Empowered Birth Academy, everything I teach, you need to get past your fear first. If you are still afraid, the nurse has a button that she can push on you that gets you to comply with her checklist. If you are not afraid and you trust your body and you have your outside support in your team with your partner and your doula, that nurse, no matter how much she pushes on that outside to try to get you to do something, she doesn't succeed. So that is why you need to be aware that if there's a pushy nurse, you either have to get a new nurse, or if that's not possible, having those advocacy tools in your tool belt and getting past your fear and understanding your body's natural process is a huge advantage if you are having a hospital birth. And this again ties into number 11, which is doctors and midwives. If nurses are already unsupportive, doctors and midwives can also be a detriment, depending on how they were trained. So the doctor that Jenny got, she was very fortunate that he supported physiological birth. He did not have the OB mindset of needing to control everything. So he saw her plan, he saw her birth plan, and he actually called her up and said, I know you went to my colleague to look into getting a VBAC, but can I be your doctor? This in itself was unheard of. And when Jenny told me this, I'm like, oh my goodness, like it's almost like you attracted this person in with your birth plan, which I now call the glass slipper birth plan. And I do have a whole system about that. I will teach it at a later date. Or if you have any questions, you can always reach out to me, hello@empoweringmomsbirth.com. This is not currently inside of your Empowered Birth Workshop. This is something that came up a lot later on, and I will probably be doing a self-study program on it. But what you really need to understand is if you have a very solid birth vision and you have that confidence going in, the medical system will then change their tune about hands-off birth. Because what they have been trained on is hands-on birth. You have to understand that they have been basically going to school for a number of years where they are being indoctrinated into a system of telling them everything that could possibly go wrong. Doctors get this a lot more than midwives, but midwives are still not immune. If you read Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, there is a quote in that book where Rachel Reed is basically talking about a midwife who knew that breaking the bag of waters was not a good idea. But then the OB walks into the room of the mother and is like, why are the waters still intact? This labor needs to be sped up. What does the midwife do? Well, that's open to interpretation. But the fact is that your midwife has their hands tied by the system. And if you want to know more about that, go check out some of my other videos on how to hire your midwife and understanding the limitations of a midwife, because this then also informs your ideas of how to advocate for yourself effectively. I also talk about this a little bit inside your Empowered Birth Workshop. I go deeper inside your Empowered Birth Academy, and it's one of my core components of the Empowered Birth system because you need to have the right facilitators. If you don't, if you have somebody who only ever sees medical birth, they are not going to be able to sit on their hands as easily as somebody who has supported physiological birth at home. This is again why midwives are a lot more ideal if you are planning a natural birth. But if you can't get a midwife, the next step is to find a care provider who is going to be willing to learn from you. If you have a care provider who is willing to set aside their biases and all of their fears and follow your lead and learn something new, that not only informs their skill set moving forward so that they can be more supportive, but it also allows you to have your physiological process. And that is how you can get the ripple effect going where we change our birth culture. Because otherwise, the medical system, they have these fears. And I have a birth advocacy report inside your Empowered Birth Toolkit. It's also inside your Empowered Birth Workshop now as a bonus guide through the email course itself. I send some emails to you that give you additional resources. And then what this does is allows you to see, oh, they're afraid. In fact, this is part of why Jenny was able to advocate so strongly for herself, because she's like, oh, wait a minute. That's why they're pushing this. It's because they have the due diligence. They have to tell me the risks. They have to make sure that all of the T's are crossed and the I's are dotted and that the checklist is done. But I don't have to take on that fear. So by doing this, by understanding that she didn't have to take on this fear that was being projected, she was then able to be like, okay, well, what exactly is your concern here? The doctor told her his concern, and she's like, oh, okay, well, I have a backup plan for that. And then she pulled out the backup plan, and then it was fine. So having your solid birth vision and having your backup plans and understanding the motivations of your care provider and understanding the underlying fears allows you to be the birth consumer and basically guide your care provider to support you better. If you don't have that, if they don't know how to sit on their hands, they're going to try to do things during your birth, which then interferes with the physiological process unnecessarily. And if you understand physiological birth, you know that hands-off birth is what nature actually intended. When they start to get hands-on, that then affects your ability to follow your intuition, and things don't work very well. So if you're calling in medical support, you always need to know why you're calling it in and what level of support you actually want. If you just put somebody there to catch the baby because you know that you're going to need that extra support, you call that in. If you know that you need somebody to press on your back, you call that in. If you notice that something's wrong and you want to be assessed, you call that in. But you don't take the entire medical birth package because, again, they don't know how to sit on their hands. But birth happens all the time unassisted, unintentionally. Babies are born in cars. Babies are born at home. Babies are born on the side of the road. They're born on planes. So recognizing that when you're hands off, you have a better chance of having a true natural birth that is less painful and less traumatic, and you're less likely to have any birth injuries than if they're hands-on. Then we know we aim for a true natural birth and we pull back only as much as needed, and we confidently train the medical system to support us. But it can be really, really hard for you to do all of this when, number 12, you don't have supportive family members. And part of the reason why I teach so much on getting past fear is because this is all interconnected. The medical system does things, and we all basically just accepted this as how birth is. Your family and friends are in that same system. They have grown up with the idea that the doctor knows everything. They have ideas that the episiotomy is better than a tear. It is incredibly difficult to change somebody's mind about that, and they don't always want to be open to learning about physiological birth. They just have that mindset, well, I tore and that was bad, and I'd rather be cut because that was easier to stitch up. And it's like, okay, but the reason you tore that bad is because they were pulling on your baby, you had the epidural, and they were doing things to you during that birth that led to that really bad tear. But if you have the episiotomy, you're going to get the same result, because if you cut a piece of fabric, it's going to tear. So recognizing that there's a lot in our birth culture, and I talk about this inside your Empowered Birth workshop as well, where we have these ideas about birth that have been perpetuated by the medical system. And originally, obstetricians wanted to be able to justify being able to charge more for their services than midwives because they wanted to push the midwives out. And so in order to justify that, they had to basically convince everybody that birth was more dangerous than it really was, so that people would stop hiring the cheaper midwives in the community who were more effective at what they did, but they were women. And there's a whole big thing about women in society at certain times in history that there was a lot of bias and misogyny and this idea that women were not as intelligent and women weren't allowed to read. Women weren't allowed to write. Women weren't allowed to practice medicine. So when you look at that context, and then you look at all of these medical procedures being done, and then you look at that from the lens of how many generations of women went through that and were medically gaslit and also gaslit by society to believe that a healthy baby is all that matters, suddenly you recognize why those unsupportive family members who would rather you just go to the hospital or just do as the doctor says or just induce or think that an episiotomy is better than naturally birthing without anybody touching you, and thinking that home birth is this dangerous thing and women died in childbirth and how could you possibly put your baby at risk? All of those things, it gets into your head because we have been also trained culturally to not go against society. And these are your family and friends. So, of course, they're going to be afraid for you. And they're now projecting their fear onto you. So you need to be able to get out of that. And that is what the empowered birth method really does. Because I noticed that birth education on its own does not work. I can sit there on the mom forums until I am exhausted trying to get that information to moms who are saying, I would rather have an episiotomy than a tear. I would rather have a C-section than ruin my pelvic floor from a big baby. It doesn't matter how much evidence to the contrary is put out there. It doesn't matter how much physiological birth information is out there. If the underlying fears have not been addressed, there's cognitive dissonance that happens. And you might want to check out some of my other trainings that I do. I do resetting your mindset trainings. I do a lot of work on getting past fear. It's also embedded into a lot of my master classes. So you can just basically go into any one of my master classes, get the overview of how to get past fear. But the best way to get past this again is if you read Your Empowered Birth and go through Your Empowered Birth workshop, because that gives you the tools to start releasing those fears. You can't change the minds of your family and friends. I'm sorry. The only way that that's actually going to change, if it ever does, is by you doing the thing and then them looking back in hindsight and being like, oh, I guess she was right. And even then, I have been in the birth community for over 10 years. I had a home birth with my second baby. I had a completely natural birth in the hospital with my first. When I was pregnant with my second baby, I was an active birth advocate. I had a lot of knowledge, more knowledge than I'd had with my first pregnancy. And my family still did not like the idea of me planning a home birth. Even though nothing went wrong, even though I had proven that I could have had my son at home, they still tried to scare me during my second pregnancy. But because of what I knew, I just tuned those voices out. So that is what I'm going to suggest you do. Tune those voices out. Number 13 on the list, we're going to go back into the medical birth traps. Pitocin. So many moms, they say, I tried a natural birth, but it didn't work out. I wasn't dilating fast enough. They gave me Pitocin, and then it was really, really painful. I'm going to tell you right now, Pitocin is not the same thing as oxytocin. I do not care if they take that name and they call it oxytocin on the label, because in some places, especially in Canada, they call it oxytocin. It is not oxytocin. Oxytocin is the hormone your body naturally makes when you are relaxed. Pitocin is synthetic. It makes contractions longer and stronger and closer together, often one on top of the other. There is no break. There is no pattern to it. There is no method to it. It's literally like trying to smack ketchup out of a bottle. If you are trying to just smack ketchup out of a bottle, it's not going to work. The contractions that are produced with oxytocin have a real purpose. It is to help get your uterus nice and strong, bring the fundal muscle up, and to basically start thinning out your cervix and pulling up those muscles. That is the purpose of actual contractions. There are 3 different types. 1, getting those muscles nice and strong and firm up at the top, and then also shifting the baby in a certain position. And then the 3rd one is to push the baby down. That is the contraction pattern. Pitocin is over and over and over. Squeeze, 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 squeeze. There is no rhythm to it. Of course, it's going to be more painful. Of course, it's going to cause problems. It's going to cause the baby to go into distress because there is no biofeedback happening. With regular contractions, if there's a contraction that's too strong for the baby will signal that that was too strong. And then the uterus is going to adjust and be like, okay, that one was too strong. We're going to adjust. That's not happening with Pitocin because it's overriding your hormonal process. It's overriding your oxytocin production. This also can then lead to hemorrhaging because, again, your body is no longer producing the hormones. It is completely synthetic driven. When you understand that Pitocin is not oxytocin, when you understand the difference between physiological birth and medical birth, you recognize why so many births with Pitocin end up with C-sections, end up with more assisted vaginal deliveries, end up with more pain, and end up with the epidural. When you understand that, you also understand why there's more hemorrhaging that happens with Pitocin. Pitocin is not your friend. If you are being pushed to have Pitocin, really, really question that. This is, again, why you wait until the last minute to go to the hospital, because the hospital is not set up for physiological birth. If birth is taking too long, they need to speed it up because their job is to fill beds and empty beds. So if you stay out of the hospital, you're not going to get Pitocin. If you go in too early, they're going to try to push Pitocin. So you need to understand that. And in that same line, number 14, induction, is the same idea. Your body is not yet ready to give birth. And yet you're trying to push on the outside. Maybe it's a mechanical method, or maybe it is Pitocin. Maybe they've broken your waters. Whatever they've done, you are no longer having a physiological birth. Rachel Reed is incredibly clear about this inside of her book, Why Induction Matters. That the second you induce labor, you are no longer having a physiological birth, which means that there is more likely a chance of complications happening if that baby was not ready to come and if your body was not prepared. If you do choose to have an induction, make sure it is a very informed choice. Make sure you have your backup plans. Jenny knew that there was a possibility she might need to induce because she had chronic high blood pressure and had a history of preeclampsia with her first baby. However, in her plan, she had several backup plans for how she would handle possible complications coming up and at what point she would agree to a C-section. She understood about induction. You need to be understanding about physiological birth to be able to understand the true risks of induction and what is lost in the process, and to make informed decisions about induction. If you do not have that conversation and you do not have that education, what happens is you end up falling into that induction trap because the medical system has been trained to think that induction is safer than physiological birth. The medical system is also given incentive to induce labors because it allows them to fit you into their schedule. It allows them to predict staffing because, again, they can now control the process. And because so many people are giving birth in the hospital, this does overwhelm the staff. So if we were able to switch the culture to a more physiological minded culture instead of this induction culture, you would see a drop in a lot of complications. You would also see a drop in how much things cost overall. Whether you are in the States and have to pay insurance, or you're in other countries where our medical system is basically free, you still have to understand that there is an underlying cost factor. And when you are spending a lot of money in maternity care, that takes away from everything else. It takes away from staffing for other things. And for moms who want to have a natural birth, we really don't need to have that level of control. But because of so many complications that happen with inductions, people have now been in this idea, this mindset that induction is the way to avoid a C-section. Induction is better because you can still have a natural birth. No, you can have an unmedicated birth with an induction. You cannot have a physiological birth with an induction. There is no such thing as a natural induction. There is no such thing as having a natural birth with an induction. If you have an induction, be prepared for the possibility of your birth becoming even more medicalized, because that is what you are choosing. And I am going to stand on that hill. I will die on that hill to tell you that induction is not the answer if you are going past your due date. Number 15 on the list is staying in bed. So labor is an active process. In the early labor, yes, you want to be resting as much as possible, but even then, you're not going to stay in one position. You might shift positions. There's plenty of times where I tell my clients, use the modified child pose from yoga to basically fall asleep while in early labor. Or if you're in the pool, you can still fall asleep. You want to be resting. You want to be somewhat upright. You want to be shifting positions, but you don't want to stay in bed the whole time, because if you do feel like you need to move, being stuck in bed is the absolute worst thing. If you're stuck in bed, like say on the monitor or stuck to an IV, or you have a catheter because they've basically just decided that you can't get out of the bed, this then makes it more painful for you. Your baby isn't able to get in a good position. And then this is when babies get stuck. This is when you have more pain in labor. I hated being on the bed. It is not a comfortable position. So recognizing that staying in the bed, not going to help you with physiological birth. It's just not. In that same line, number 16, the IV. You don't need that either. If you're having a physiological birth, you're supposed to be eating and drinking as needed. And if you're waiting until the last minute to go to the hospital, you're not getting an IV. However, because of the way that our birth culture and medical system basically runs, they are always worried about what if something happens, we need to have an open vein to be able to handle this emergency. Birth is not an emergency. When you have that fear-based mindset, what this does is it opens the door for a cascade of interventions. Even something as innocuous as an IV on the outside can cause problems during your birth. Not only that, if they're giving you fluids, this also causes swelling to happen. This can cause it so that your baby, when they're born, has more water weight than they otherwise would have had, which then changes their birth weight so that when they lose all of that weight, they're suddenly underweight. And then they start suggesting formula. An IV is also incredibly distracting. Even a heparin lock. You're getting a needle shoved into your vein when you're trying to stay in an active state of surrender and calm. It's not going to help you. Not only that, there are some care providers that aren't exactly going to tell you when they slip you medication. If you have the open vein, it is so much easier for them to do it, even if you're saying no. It is much more effective if you are planning to have a true natural birth to say no to the IV. You don't need it. You really don't. If you are having a medicalized birth, then that's when you put in the IV. But if you are having a true natural birth, no, you don't want the IV. And of course, I will go deeper into this in later videos. I will tell you about the risks and benefits of the IV. I will tell you about the context that comes around this. And if you want to know more, though, you can always check out Reclaiming Childbirth as a Rite of Passage. I'd also suggest checking out The Thinking Woman's Guide to a Better Birth by Hensi Goer, because there's a whole chapter on the IV and why you don't need it. Another intervention that's very common in the hospital that you don't need is continuous fetal monitoring. This has been proven over and over again to not be as effective as people are led to believe to avoid a C-section. In fact, it increases the possibility of you having a C-section because of how many false positives that come up that say that the baby is in distress when the baby wasn't actually in distress. The fetal monitor also requires you to be immobile, which, as I said from number 15, causes you to have more pain. If you can't move around in labor and you're strapped to that monitor, what this does is it hinders your labor from being able to progress the way it really needs to. Not only that, but a lot of nurses will look at the monitor and not actually pay attention to you when you are saying that contraction actually wasn't so bad. And they're like, oh, but on the monitor it says it was really strong. So then if that's the case, you must have a high pain tolerance. But then you have a little contraction and you're like, oh my gosh, that was really painful. And like, no, it couldn't have been because the monitor says it was only a little one. If you can't handle that, maybe you should get the epidural now. Or the contraction pattern doesn't follow what they think it needs to. And then they're like, well, this is a very irregular contraction pattern. Nothing should be happening. You can't possibly be this close to pushing. And then the baby's almost out and they don't believe you. So you have to understand that monitoring contractions and timing contractions, even outside of the fetal monitor, when you're doing it with an app, no, the physiological birth does not follow a set pattern. This is, again, what's happened with our medical-based birth culture and the way that men basically tried to control birth and think that things had to go a certain way and had to be efficient, and if they weren't, it was a problem. There's a whole big mess that we've gotten into with this reliance on technology. Now, if you are having a medicalized birth, if you are having an induction, then that is the time to bring in fetal monitoring, because now you are not using the hormones of your body. You're using a synthetic hormone that can and will cause more irregular contractions and harder contractions than you would otherwise have if you were having a physiological birth. You need to be able to monitor that, because if something is going wrong with that medication, that's how they need to adjust the dosage or wheel you in for a quick C-section. But otherwise, no. If you're having a true natural birth, you don't need continuous fetal monitoring. The best way to avoid this, again, is to go to the hospital at the last minute or have a home birth, and then that's not even an issue. Number 18 of the natural birth traps is trying to be quiet. So birth is noisy. You have to understand birth is noisy, especially as you get deeper into your trance. If you think about this in terms of sex, if you're having a really powerful orgasm, trying to stay quiet when everything in your body is screaming for you to shout out loud what's going on and make those sounds, it's going to shut down your orgasm. The same thing with birth. The big problem with the medical system and our birth culture is that we have been trained to be quiet. And a lot of labor wards, if they are very quiet, it's because everybody's had the epidural. And it's easier for the nursing staff if you have the epidural, but it's not easier for you. This is again why I suggest going in at the last possible minute. Because if you are the only one on the labor ward and you are making all of the noise because you are having a physiological birth, but they are not used to that, they're going to think you're in a lot of pain. Even if this is just the way that you are able to do your labor and not feel pain, because this is what I noticed during my home birth is that if I kept quiet, it was painful. If I let the sounds come out, I didn't feel any pain. It was just a little bit of pressure, and I moved with the waves. So I am very noisy during labor, and I make those deep guttural sounds during labor that makes it sound like I am having an orgasm. And I make sounds that other people would be like, do you need any medication? And I'm like, no, this is just my process. This is just what I need. But if you aren't aware that making noise is normal, because all you see are those birth videos where they have the music over the voices of the moms, or the mom is just breathing her baby out. She's very quiet about it. You don't realize that that's actually like there's a range of how you're going to react at certain points. And if you scream and you do your thing, and that's what helps you move that energy through you, and it makes things less painful, then by all means do it. Do not try to stay quiet. And if you're self-conscious about the noises you make, stay home. Because if you stay home, then you're less likely to have that self-conscious feeling of I'm being too loud and I'm disturbing everybody. So understanding that you need to be able to make noise, and I can go into this deeper. You can also learn more about this if you check out Ina May's Guide to Childbirth. She talks about it. She talks about how your vocal cords are actually tied into your cervix as well. So the more you're allowed to work through your vocal cords, the more you're directing that energy downwards to open up. And it's just, when you understand this, then you recognize that when people tell you to be quiet, they're screwing up your process. You want to kick those people out of the room if they want you to be quiet. They need to recognize, and your partner needs to recognize that this is normal, and it doesn't mean you're in too much pain, and it doesn't mean that you need to get the epidural. If you're really concerned by the amount of noise you make, have a code word for if you actually want to call in any medical intervention or pain relief, because that way they know you're serious. If, however, this is just part of your process, you're not going to use that code word. Number 19, I kind of already touched on, which is being on your back, because this narrows your pelvic outlet. This causes your baby to not be able to navigate the pelvis. This can lead to back labor. This can lead to you having to push uphill. This is also cutting off a lot of oxygen, and it can also be just really, really uncomfortable to try to get through a contraction on your back. If you are having a fetal monitor, or you are otherwise on your back for a contraction, like say maybe you were sleeping in bed, then shaking your leg through that contraction can ease off that pain. However, the best way is to just not be on your back, because if you are on all fours, your baby is able to turn a lot easier. They're not stuck. But if you're on your back and the contraction is trying to move the baby, it's just not fun. So if you want a less painful birth, stay off your back. The only thing that I would say as a caveat to this is if you are instinctively being told by your body, for this contraction, I need to be on my back, or for this push, I need to be on my back, or I need to lean back a little bit more, or else I'm going to tear if I'm too far forward. But again, this is following your body. This is not following the outside advice. Do not follow outside advice when it comes to birthing. This is an instinctive process. And we have been taught in our birth culture that there is a right way to push, and it's not true. There is no right way to push. There is your way, the way that your body wants you to do it. There is no right way to labor. There's your way. There is no right timeline. There's your timeline. The sooner we start to recognize that we need to tune into our body and not the outside, and only use the outside information as a guide, and only take what really works in the moment, and not try to do everything by the textbook, that is when birth is going to start to be less painful, less traumatic, or not traumatic at all, and that will inform our birth culture. And that leads to number 20 of the natural birth traps, which is basically the culmination of everything. Mainstream birth culture and education that basically tells you how to prepare your body for birth, what to do to get yourself into labor, what to do to push on the outside to make your birth more efficient. Because the truth is that birth is not an efficient process. Birth is not linear. Birth is not one size fits all. And when we treat birth as one size fits all, that is when we fall into those natural birth traps. That is when birth becomes painful and traumatic. That is when we are making decisions out of fear instead of from a place of deep intuition and inner knowing. Your body already knows how to birth. I could keep talking about birth all day. You could watch every single one of my videos. You could go and get a crash course birth education. But at the end of the day, you and only you know how to birth your baby. You and only you can birth this baby. And you and only you are tuned into your own intuitive knowing and what you need to call in. Nobody else can decide this for you. Going into the mom groups and asking a bunch of questions on what they recommend is not going to serve you. Asking your doctor how to push or what to do is not going to serve you. You have to be able to come to your own intuition. You need to be able to get past all of the fear that society has put on you over generations of this culture of fear and misinformation in birth. You need to unlearn what you were taught. You need to go back to trusting your intuition. We are now at a point in our society where we have access to medical support when we need it. We also have an innate knowing of our biology that is starting to come back. And we also recognize that things are not the same as they were in the past. We are not property anymore. And let's keep it that way. We also know that our bodies are designed to birth. We just forgot that our bodies are designed to birth. And the fear that's placed on us is what's holding us back from truly trusting ourselves. The cultural idea that the medical system knows more than you do just because they have degrees and you don't is patriarchal construct that is basically designed to have you not trust yourself so that they can profit off of your body. I'm just going to say that because it's the truth. The medical system came into being because they wanted to be able to profit off of pathology. They recognized that birth was a lucrative business model if they could control it. Physiological birth is incredibly inconvenient to a business model that requires birth to be efficient, to fill beds and empty beds. When you understand this deeply, as I have gone over 10 years of experience, and even before that, seeing how psychology really informs our choices and understanding the role that the media plays, the role that our birth education plays, the role that our families of origin play, and the role that the medical system plays in this, and that fish can't see the water they swim in, the more I've seen this, the more committed I am to you having an empowered birth. The more committed I am to getting that information out there. And again, information is free. You only pay for access to me. So if you really want that education, you really want that information that is going to truly help you to get out of that cultural indoctrination and to start weighing your options properly so that you don't fall into the fear traps and you don't end up in the natural birth traps, and you have that natural birth and you avoid the C-section and you avoid the induction and you avoid all of that pain and trauma, then I'm just going to invite you to keep following this channel. Like, share, and subscribe. Pay it forward. Pass this information on. I have a lot of resources on my website. As I said, I have 3 paths to getting the empowered birth method. One is completely do it yourself. You don't even have to put in your name and email. All you have to do is keep following these videos, get any of the free resources that I have on my website. If you do want to go the second route, which is self-study, there are 2 paths within that. The complete self-study, which you take the course, you go through the workbooks, you do all of the work, you do the exercises, you implement, you get the results. Or if you want self-study VIP, that comes with direct email support. You do pay to have access to that. But otherwise, I'm committed to you having an empowered birth. And premium coaching is not available to everyone because it is a high price tag to work with me. I'm worth every penny. I've saved my clients sometimes $30,000 from not having to have a C-section to being able to just have their baby at home. I have also been able to turn around situations that would otherwise be very daunting for a mom to have a VBAC after 3 previous C-sections in a hospital that was so convinced that if she went and had one contraction, if she went into labor, that her uterus would just automatically rupture, which there was no evidence to support that claim. But because they were not going to look at the research outside of their own country, they were so against her having a VBAC. And then she made medical history. But again, I don't work with just anyone. And it's very steep. It's a time commitment to be able to get me as a coach. So that is why I put this information out for free. And if you did find value with it, please like, share, subscribe to this channel, pass it on, pay it forward. And if you want to know more about my self-study program, Your Empowered Birth Workshop, you just go to empoweringmomsbirth.com/workshop. So that's all I have for you today. We will be going deeper into this at a later point. Thank you so much for watching and have a happy empowered birth journey. I'll talk to you soon. Namaste.